I welcome you all to the Healthy Heart, Healthy Life Pune, session 16. I am Dr. Neelkant Karandikar, senior practicing cardiologist from Pune, honorary professor emeritus in cardiology, and the first gold medalist of Bombay University, now Mumbai University, and my attachments are given over here. A very vital question about which we are going to deal with today is: which is the life-saving procedure even a non-medical person can do? You guessed it right. It is CPR, or cardiopulmonary resuscitation. CPR is a procedure using which over 1 million of lives have been saved over the past century by non-medical people. It is a procedure about which every health-conscious person should have a full know-how. If you see a person lying unconscious somewhere, what is the first thing that you should do? With an intention of reviving that person, tap on the person's shoulders and ask the person, how are you? Are you all right? Ask 3 times, are you all right? Are you all right? Are you all right? If there is no response, that means the person is unconscious. Then quickly check over 5 to 6 seconds, maximum 10 seconds, the pulse of the person and the breathing of the person. We have seen in our last session how to check the pulse. This is the radial pulse being checked with 3 fingers on the inner side of the forearm, on the thumb side with 3 fingers. Then we saw how to check the carotid pulse by the side of the neck. We also saw how to check somebody's breathing. We have to do this very fast in an unconscious patient because we don't want to lose time in reviving him. This is another method of checking a person's breathing, keeping the hands on the person's abdomen and seeing if it is going up and down. In case you have a pulse oximeter, which actually most ambulances have, then you can check the oxygen saturation in the blood. And we have seen last time that 95 to 100 is normal, up to 88 is something to worry about, but below 88 is serious. Now, who requires cardiopulmonary resuscitation? The person who has had a cardiac arrest and not a person who has had a heart attack. First, let us see what happens in a heart attack. Heart attack may be called a plumbing issue. Like a clogged pipe, blood flow is blocked to the heart. One of the arteries of the heart, called as the coronary arteries, there is a block. The artery gets fully blocked, and depending upon the size of the heart muscle being supplied, you get a small attack or a big attack. And what happens? Arteries to the heart muscles are blocked by plaques, clots, preventing blood flowing to the heart. Commonly, shortness of breath, chest discomfort, which is very important, tightness and nausea. In the center of the chest, there is tightness. Heart continues beating, but muscles may slowly die from lack of oxygen. Can be slow to progress, but usually the process of cell death in the affected part is completed by 4 to 6 hours. You have to call an ambulance, be prepared to do a CPR if the person becomes unconscious or stops breathing. Now, this is a heart attack. The heart is still beating, though maybe not completely normally. But here you don't need a CPR. CPR you need with a cardiac arrest, which is an electrical issue, like a power outage. The heart has stopped beating. The electrical currents in the heart are affected. The heart stopping the flow of blood to vital organ. The heart stops beating properly. And in fact, the heart stops pushing out blood from its cavities, main being the left ventricle, and there is no blood going to the organs. No warning. First sign of a problem is the passing out and becoming unconscious of the person. Heart rhythm interrupted, stops pumping blood around the body. Casualty, that means the person affected, stops breathing and becomes unconscious. Seconds to become unconscious, death within minutes if no treatment is given. Call an ambulance, do CPR, use a defibrillator if available. Now, what is a defibrillator? When the heart has stopped breathing, ideal thing, is this machine called defibrillator, which is there in most ambulances, and it has been recommended that in airports and at big public places, such a defibrillator machine should be available. The pedals are kept on the patient's chest, and when the current is passed, there is an electrical stimulus to the heart, and the heart may start beating again. Or if the heart has an abnormal rhythm, such as ventricular fibrillation, as it is called, then that can be corrected also to normal. So let us now begin the topic proper. Cardiopulmonary resuscitation, or CPR, is a life-saving technique used in emergencies like heart attack with cardiac arrest or drowning, in which heartbeats and or breathing are stopped. What is the definition? Cardiopulmonary resuscitation is a basic life support BLS technique for oxygenating the various organs of the body, especially brain and heart, until appropriate definite medical treatment can restore normal heart and ventilatory function. What are the objectives? First and foremost, to save the life of the patient, maintain blood circulation by external cardiac massage, to maintain an open and clear airway, to maintain breathing by mouth-to-mouth respiration, to continue basic life support till medical and advanced life support arrives. You don't need medical equipment to do this. Even a non-medical person can definitely do this procedure of CPR. Survival and brain death. Timely bystander CPR can increase survival rates by 60 to 70%. Bystander means when a person becomes unconscious, whoever is by the side, he may be a stranger, he can do this CPR if he knows how to do it and save the life. To prevent irreversible cerebral damage due to anoxia, when the heart fails to maintain cerebral circulation for approximately 4 minutes, the brain may suffer irreversible damage. And that is what is very important to know, and why CPR is very, very vital. Who should perform CPR? Ideally, the patient's relative, if he's around. If the relative is unable to do so, then the helping bystander should tell the relative that the patient's life is in danger and he or she doing CPR procedure as an attempt to save life of the person. This is important to ensure that the good intention of the person doing the CPR should not be misunderstood. Select the proper place. That is the very, very first step. If a person has become unconscious on the middle of the road, suppose, you should not give CPR over there. Some karmic comments strike you, hit you, without your knowledge. Remove the person quickly to the side of the road. Move the victim to a flat, firm, and safe surface. Tap the victim's shoulders and ask loudly, "Are you all right?" Repeat 3 times. The tap should be gentle but firm to help the patient regain consciousness. If he regains consciousness, well and good. If not, we have already seen, check the pulse, breathing. If that is not there, you start CPR immediately. Checking of the pulse and breathing should not take more than 5 to 10 seconds, maybe 5, 6 seconds only, so that you don't lose vital time. First thing to do is to open the airway. Head tilt, chin lift, and jaw thrust. Here you can see that the head is being tilted back, the chin is being lifted up, and the jaw is being pushed ahead. in front, which is called as a jaw thrust. This procedure, this maneuver, will open the airway as it is shown here. We don't want a blocked airway in a patient who has become unconscious. Then we have to do CPR. Let us see how to place the hands. It is shown here in this figure. Center of the chest on the lower 1/3 of the sternum is where you place your hands. A simpler way, 3 fingers above where breastbone meets the abdomen. Breastbone is the bone in front of the chest, called as the sternum in scientific terms. Interlock your hands, lock your elbows, and position your shoulders directly over the victim at a 90-degree angle. Here you can see that the fingers are interlocked and placed over the lower end of the sternum, which is the breastbone. And this is how to place the hands to give the CPR. Chest compressions, the rate should be 100 to 120 compressions per minute. Perform 30 compressions, and then in each compression, push down about 2 inches, that is 5 centimeters. Use your body weight to push. Ensure that the chest returns to the normal position before you give the next compression. Count loudly as you compress, so that you know when you finish the 30 counts, you can give 2 rescue breaths, as we will see now. What are rescue breaths? After 30 compressions, give 2 rescue breaths. Oh, sorry. This is a 30 to 22 ratio, 30 to 2 ratio, or 30 to 2 cycle. Chest compressions are more important than mouth-to-mouth breathing, as near adequate blood oxygen levels are maintained for about 10 minutes after the heart stops. If you do good cardiac massage, that is the most important procedure. Airway also ideally should be kept open. Use the head tilt, chin lift maneuver, which we just saw, to open the airway. Use the non-dominant left hand to tilt the head back, lift the chin, and you have to pinch the nose. Pinching the nose is crucial so that the air you push in through the person's mouth does not escape through the nose. Put your mouth against the patient's mouth. You may use a handkerchief in between if you so desire. Blow air into the mouth to make the chest rise. A pocket mask from pharmacies or first aid kits can be placed on the patient's face. This is usually there in the ambulance. Now let us revise the steps one by one of a CPR, cardiopulmonary resuscitation. First is move the person to a scene safety. That means not in the middle of the road, not near a big fire or something like that. Check patient response by tapping on the shoulders. Check patient's pulse, radial, carotid, and also the breathing. Call for medical help. Start CPR immediately. Begin cardiac compressions. Use dominant hand heel for compressions. We have already seen that how to place the hand on the chest of the person. Maintain compression rate of 100 to 120 per minute. Push down about 2 inches, 5 centimeters. Use your body weight to push. Give 2 rescue breaths after 30 compressions. So 30 to 2 cycles should be maintained. Tilt head, lift chin, and pinch the nose, and perform mouth-to-mouth ventilation. This is all stepwise the cardiopulmonary resuscitation. Cardio means heart, pulmonary means lungs, and resuscitation means an attempt to revive. CPR in adults and older children. Again, with this picture, let us revise. Place both hands in the center of the person's chest, locking the fingers like this. Using your body weight, push hard with your hands. Keep compressing at a rate of 100 to 120 beats per minute. Do 30 chest compressions followed by 2 rescue breaths. Now, this is a video which I would like to show you. This is a model which we call as a torso, and this person is demonstrating how to give cardiac massage on this torso. See, he's standing right above the person's chest, His hands are interlocked and he is pushing down around 5 centimeters, right? And another thing to note is that the chest is getting fully expanded before the next compression, and the rate is perfect, around 100 per minute. Thank you very much for watching this video. We have dealt with a very important topic of cardiopulmonary resuscitation. As a health conscious individual, we all must be aware of this procedure called CPR. As doctors, we have done it in our coronary care units several times, but this procedure can be done by anybody without any medical equipment and certainly can save lives. I thank you again for watching this very important video. If you have not subscribed to my channel, I would request you to subscribe, give me a thumbs up, tell about my channel to your relatives, to your friends and other people so that this important knowledge can be spread to maximum number of people, as many as possible. Thank you very much. Thanks.